Good morning, everyone. This is Dr. Patmos, and it is February 1st, 2026, and I have a provocative video for you and for Dr. Vinay Prasad of the FDA. I just stumbled this morning upon a video from Dr. Prasad. I think it was just done recently, maybe today. It was posted by Dr. Jonathan Howard. I follow his Substack and or his YouTube channel, and he had this article, this video from Dr. Prasad from his Substack, and it is linked below, and I want to respond to it. So, for those of you who don't know, Dr. Vinay Prasad is an oncologist, quite well trained, excellent credentials. He's on the faculty at UCSF, and he is a very vocal, vehement contrarian when it comes to COVID. He opposes masks, he opposes vaccination, except in the very elderly and sick with chronic disease. And he was harshly critical of all of the things that infectious disease and infection control practitioners recommended during the COVID pandemic. And he derides them uh, terribly, as these are all terrible mistakes. Well, in his most recent video, he goes on to attack masks and masking and suggests that, and he goes through into great detail on what's wrong with the data, that there isn't really great randomized controlled trials, that the trials that are out there are retrospective and not well designed and so on and so forth. And he basically is critical of the New York City Department of Health, who just recently re-implemented masking requirements because of this season's absolutely horrible outbreak of influenza, RSV, other respiratory viruses, and the fact that COVID is still out there. In this video, he also um, minimizes the toll of death from the COVID pandemic. Let me just put a number in perspective. He laughs it off about COVID being particularly dangerous. 1.2 over 1.2 million Americans died from COVID in the United States. That's more death than all the combat deaths that the United States sustained in every single war we have ever been in. The Revolutionary War, the War of 1812, the Civil War, the Spanish American War, World War I, World War II, Vietnam, Korea. All of those wars added up didn't result in 1.2 million American deaths, but COVID did. So when Dr. Prasad minimizes the impact of COVID on this country, I have to wonder where was he? Was he in the hospital at that time? I just don't know how you could be so cavalier. He also completely ignores the fact that when people get COVID over and over again, they they have much greater risks of long-term disability. He seems to be oblivious to the concept of long COVID and the fact that millions of these people have been left disabled with other uh, things that have followed from it. And just recently, I saw that even the risk of diabetes is much greater following COVID. So and we got to remember now that it according to Dr. Prasad and Dr. Bhattacharya, Dr. Makari, children are low risk, so therefore they shouldn't be, they need not be vaccinated. And as a result, the vast majority of children are not vaccinated against COVID. So they're basically the host reservoir now, maintaining the virus for the rest of our benefit. But he seems to just completely disregard the impact that this has, that long COVID and COVID infections have had on children. He seems more concerned about the fact that kids had to be, that we had to like close the basketball court than protecting, children's lives. Well, anyhow, I attached his video so you can listen to what he has to say. He's very intelligent. He makes some good points. The data on masking is not perfect. We don't have great cluster randomized controlled trials to tell us, with precision. We have evidence, and the evidence is imperfect, but it's the best we have. And the evidence we have clearly points toward the benefit of masking. Um, if then if he goes on to say how easy it would be to do the correct studies or the ideal studies, these randomized cluster randomized control trials. Well, Dr. Prasad, You're in charge. You and Dr. Bhattacharya and Dr. Makari are the big three. You control everything. You have the NIH, you have the FDA, you have all the money, you have all the power. You don't think that the studies are good enough? Fine, go fund one. You could do this in a heartbeat. You and your colleagues have access to billions of dollars. You said it's a cheap and easy study to do. Why hasn't it been done? Do it. Come on, let's see the data. Design a good study, put it to the test, and let's see. And if the results come back supporting masks, I hope you will retract your prior words. In the meantime, I choose to wear a mask based upon the data that we do have. In the meantime, I choose to recommend to my patients that they wear masks. I won't wear a mask in a high risk setting because I don't want to infect other people. That's my moral duty. And even in the absence of perfect data, it's still good enough for me to honor uh, what I believe is my ethical duty. Now, I did neglect to mention earlier, and if it's all in the text below. Dr. Prasad has a problem with infection control. There's something about infection control, infection prevention that's missing in his paradigm, because if you recall, he wrote the absolutely most disgustingly titled article ever written by a doctor that I've ever seen, entitled "Blood, Shit, Piss, and Pus." Now, I'm sorry to use those words, but that's the title of his article. And in that article, Dr. Prasad describes routinely, he says that he routinely, not just he and his colleagues routinely come in contact with the blood and body fluids so vulgarly described above in his paper. Uh, I got to tell you, as a trained internal medicine physician with added qualification in infection control, I was appalled by that. Any doctor or nurse or anyone in the hospital who inadvertently comes in contact with blood and body fluids needs to share that with infection control. They need to be tested and protected and so on and so forth. He seems to suggest that this is a routine matter, that he's splashing around in human excrement and body fluids in the hospital all the time. Well, if that's even remotely true, then you are a hospital hazard. And I can't believe that UCSF, where you work, would actually allow this to go on. So I think there's being a little overly dramatic here, Dr. Prasad. So my message for today to all the viewers is, yeah, the data isn't perfect. We don't have data that prove, for example, that closing surgical incisions works. So what are we supposed to do? Tell surgeons when you do that exploratory laparotomy, just leave the wound open because we don't have data that closing a wound actually works? What are we supposed to do? Just leave surgical incisions open? We don't have data that parachutes work. What are we supposed to do? Have people jump out of airplanes just to see and do a randomized controlled trial of parachutes? There's lots of things in medicine, many of that we do where we don't have perfect data, but we have to rely on the best data that we have. I am not opposed to having more data on masks. I would love it. I think it would be great. You are the big cheese now. You are in charge. Go do it. You're critical of masks? Answer the question. Design the studies, fund the studies, and let's see what happens. Let the chips fall where they may. In the meantime, don't disregard the significance of 1.2 million dead Americans. Maybe no one in your family died, but there are 1.2 million families who just celebrated the holidays without their loved one being there. And there are children all across this country right now who are struggling because they were left damaged by COVID. They could have been protected, but you and your colleagues recommended against it. So that's my post for today. And to Dr. Prasad, you don't like the data? Come up with better data then. It's your challenge. Game on. You've got it. You've got the purse strings. You've got all the power, buddy. You're in charge. You're the big cheese. Make it happen.